So this is what I call the blueprint behind Lyme disease politics. I mentioned that it's all done to create a market. This is an article by CDC authors on the cost effectiveness of vaccinating against Lyme disease. And these are CDC authors, and I call this the smoking gun blueprint of what's going on with the Steere-Camp of Lyme disease. So they come up with this formula which shows at what point a Lyme disease vaccine would be cost effective. I've reproduced this formula here. I'm just going to go over it quickly. Basically, you want to minimize the cost per case averted, which means you want the vaccine to be as cost effective as possible. So to do that, you want to make this denominator large, and you want to make the numerator small, because a small number divided by a large number is even smaller. So what does that mean? It means you want the probability of Lyme disease without a vaccine to increase, and you want the cost of getting diagnosed and treated for Lyme disease to increase. And that's exactly what's going on. And you want the probability of getting Lyme disease with the vaccine to look small, which means you exaggerate the effectiveness of the vaccine, which is what's been done in the past. So in order to do this, you have this simple-minded, simplified disease model which prevents treatment. You increase the probability of Lyme without the vaccine, and you create this public health disaster and make it as expensive as possible to get treated and diagnosed with Lyme disease. So this also helps with not only the vaccine cost effectiveness, but it helps with the decreases the monitoring period of the vaccine trials and allows a smaller sample size. So I believe this explains the Steere-Camp mythology that's been propagated for the last 30 years or so. And in the article, they actually say that there are actually a few communities, this was back in 1999, a few communities that have incidences of Lyme disease greater than 0.5%. However, the economic benefits will be greatest in persons whose probability of contracting Lyme disease is greater than 1%. So, except for a few isolated areas, this wasn't true. So I believe that CDC policies were put in place to correct this, and CDC trained epidemiologists such as Alan Steere were put in place to justify the treatment denial philosophy. Again, I believe this is the Steere-Camp philosophy in action. Allow the disease to progress and increase the probability of Lyme disease so that the vaccine looks cost effective in comparison. Now, interestingly enough, the lead author, Martin Metzer, is also a biowarfare researcher. He actually has an article, The Economic Impact of Bioterrorist Events. He's also presented at EIS conferences, so I don't know if he's an actual EIS officer, but sure looks like he could be. So it looks to me like they're justifying what I call a compulsory vaccine development scenario. And this, again, is fresh information. Just last week or so, the AMA came out with an article, unbelievably entitled, Should Participation in Vaccine Clinical Trials Be Mandated? So what they're arguing for is that the public should not have any choice as to whether they're going to be guinea pigs in vaccine trials. So they say compulsory involvement in vaccine studies is one alternative solution that is not as outlandish as it might seem. So they say nobody's going to sign up or allow themselves to be a guinea pig in a vaccine for a common cold. However, if you increase the severity of the disease, compulsory recruitment becomes a more palatable option. So this is also consistent with what I just showed as far as the CDC article, which shows that you can increase the cost effectiveness of the Lyme disease vaccine if you allow the epidemic to grow out of control. But again, this is not only the AMA publication, this is their Journal of Ethics. That's pretty scary to me. So I ask, are we all in a compulsory vaccine development scenario? I believe we are, and I believe treatment guidelines are being used to implement it. This is a quote by Dr. Kenneth Legner. It says, this is the effect of the IDSA guidelines. Physicians have faced harassment at a minimum, and for some, their careers have been ruined. They found themselves attacked and marginalized. To persist in their research would have resulted in virtual career suicide. Again, this is happening all over the country and all over the world. Doctors are being put out of business for treating Lyme patients. So I had to think of a way that would explain how patients are being denied treatment. People with Lyme disease are always trying to explain to their friends that they're the victims of this mass conspiracy, and everybody thinks they're crazy. So I just tried to block it out and quickly show how I believe it all works. And I really do believe it works this way. Basically, as I showed before, you have these huge, powerful companies at the top who benefit from not treating people for diseases. They control the government agencies, and they've set up what I call an intellectual cartel by these Ivy League charlatans who also work for the medical societies, and they're all funded by pharma, and they come up with these treatment guidelines which are geared toward treating symptoms. And then on the other side, you have the enforcement and an information cartel. You have the medical journals and the mass media, which are largely influenced by the pharmaceuticals companies. And they all point to these guidelines, and they insist that patients remain diseased because they eliminate doctors who are treating outside of the treatment guidelines, and they therefore allow the symptoms to proliferate. And this is very profitable, feeds back money into the system. And they use that money again to control the government agencies and set up these third-party organizations. These Ivy League professors testify before the state medical boards and keep the doctors out of business. They also get selectively published in the medical journals and quoted. This is all run by pharma. Again, the doctors are discredited through the medical journals. They try to treat outside the system. They're also selectively favorably quoted in the mass media to discredit doctors that are brought up on charges such as Lyme. They also control these continuing education classes, and this is what I call the Lyme cartel. And these Ivy League charlatans like Steere, Wormser, etc. are the consigliere of the mafia, the Lyme mafia. So basically, it's all run. I can go into great detail. In fact, my presentation last year went into great detail on how this works if you want to know how it does. But it's all run by pharma. And these Ivy League professors are their hitmen, basically, and they organize and manage the whole thing for the pharmaceuticals companies. So this is a final quote by Marcia Angell. Again, she was an editor for the New England Journal of Medicine. She quotes these so-called thought leaders. She says, these are the people who write textbooks and medical journal papers, issue practice guidelines, sit on FDA and other governmental advisory panels, head professional societies, and speak at innumerable meetings and dinners that take place every year to teach clinicians about prescription drugs. That, in a nutshell, I think, is the problem. If you look at the poor doctors who are caught in the crossfire, they're redlined by insurance companies if they treat outside the guidelines. They're actually put out of business by the pharmaceuticals companies. And they're bribed if they actually treat within the guidelines and treat symptoms, they can actually get kickbacks. Of course, they've got all these poor patients screaming at them. So you got the doctors who are in the center of the bullseye, all these forces acting on them. So it takes a very brave doctor to want to treat Lyme patients for the long term. But I'm very grateful for my Lyme literate doctor who basically saved my life. And I thank all the doctors who are here today that are trying to understand. So I believe this is also implementing the Tuskegee Phase 2 through treatment guidelines, as well as using the biological warfare infrastructure to release biowarfare pathogens and keep doctors from treating their patients, because then they can run all the experiments that they want. Get better and get better.